Hi everyone, this is 11th video in our Advanced Pharmaceutical Dissolution Science and Application series. In this video, we will discuss media degassing techniques, best practices and common failures. One of the most underestimated steps in dissolution testing is degassing the dissolution media. Here we will discuss why degassing is critical for achieving accurate and reproducible dissolution results. Poor degassing is one of the most common hidden cause of high variability, unexpected failures, and regulatory questions. Understanding and controlling degassing can significantly improve method reliability and data quality. Degassing is essential because dissolved gases and surface air bubbles interfere with dissolution hydrodynamics. Air bubbles can reduce wetting, disturb sink conditions, and alter flow properties around the dosage form. They may stick to tablet or capsule surface, creating a barrier to dissolution. This leads to variability in paddle or basket hydrodynamics, inconsistent results, and artificially slower dissolution, especially for hydrophobic drugs. That's why USP-711 specifically highlights the impact of dissolved gases in dissolution testing. In short, poor degassing can compromise accuracy even when method looks correct. Trapped air bubbles are a major issue in basket methods. Bubbles inside the basket can cause floating, delayed wetting, or slow disintegration of the dosage form. This problem is worse for hydrophobic drugs which naturally repel water, allowing bubble to persist longer. Even when surfactants are used to reduce surface tension, they can trap microbubbles if the medium is not properly degassed. Degassing is especially critical for USP apparatus 1, highly sensitive to trapped air, hydrophobic API or excipients, media containing surfactants, high reproducibility methods such as biobatches and stability studies. In short, poor degassing can undermine even a well-designed dissolution method. USP 1092 provides guidance on media degassing, but it also allows flexibility as long as the approach is validated and justified. There is no single mandatory technique. Several degassing methods are available, each with advantages and limitations. The most commonly used techniques include vacuum filtration, helium asparging, sonication under vacuum, heating and stirring, and combination approaches for difficult media. Let's go through each method one by one and understand when to use which. Vacuum filtration is the USP preferred degassing method and is highly effective at removing dissolved and entrapped air. For best results, use an appropriate filter pore size, avoid excessive vacuum which can cause cavitation, filter the medium while warm around 41 to 45 degrees centigrade to improve gas removal. This method efficiently removes dissolved gases, produces consistent reproducible results, typically take 10 to 20 minutes. That's why USP recommends vacuum filtration as a reliable degassing approach. Helium sparging works by selectively displacing dissolved oxygen from the dissolution media. Helium is highly effective at removing gases, but process must be carefully controlled. Excessive sparging can overstrip the medium, potentially altering media composition. Key points to remember. Very effective degassing method, expensive compared to other techniques, require precise flow rate control, commonly used in high precision R&D environments. When used correctly, helium sparging delivers excellent degassing performance, but it's not always practical for routine QC. Sonication removes dissolved gases by using ultrasonic waves to dislodge trapped microbubbles from the medium. Applying vacuum during sonication further enhances gas removal. However, care must be taken to avoid overheating the medium, and this method is not ideal for large volumes. Key points. Fast and easy degassing, well suited for QC labs handling multiple daily batches, most effective for small volumes, When used properly, sonication offers a practical and efficient degassing option. This method is based on Henry's law. As temperature increases, gas solubility decreases. By heating the dissolution medium, dissolved gases are released more easily. However, temperature control is critical. Overheating can introduce variability and inconsistency. The typical approach is heat the medium to about 41 to 45 degrees centigrade, stir at moderate speed, then cool back to 37 degrees centigrade before use. This is most routine and widely used method for degassing. It works moderately well, but consistency depends entirely on proper temperature and string control. Stress the importance of SOP standardization, mention risk of reabsorption of gas if media rest too long. Following consistent steps is more important than which technique you choose. Key best practices include maintain consistent heating time and temperature, avoid vigorous stirring which can introduce more air, use validated vacuum levels, prepare fresh media whenever possible, monitor dissolved oxygen if the method requires it. Also remember, if degassed media sits too long, it can reabsorb gases, reducing effectiveness. Consistency is what makes degassing reliable, reproducible, and inspection ready. During method validation, you must demonstrate that media preparation, including degassing, does not affect dissolution results. If dissolved oxygen is part of the approved method, DO values must be documented and controlled. Regulators do not mandate a single degassing technique, but consistency and scientific justification are mandatory. Both USP 711 and 1092 acknowledge the impact of dissolved gases on dissolution testing, and the FDA expects a justified, consistent approach. Degassing control is especially critical for media containing surfactants, hydrophobic drugs, methods requiring high reproducibility. That's why degassing must be included in robustness testing during method validation. Good degassing is the foundation of reliable dissolution testing. It's simple but absolutely essential. Proper degassing prevents air bubbles, improves reproducibility, and reduces variability. Always use a validated technique, whether vacuum filtration, sonication, helium asparging, or controlled heating, and maintain consistent time, temperature, and vacuum. Watch out for common failures like regassing or uneven degassing, which can silently compromise results. Remember, degassing directly impacts product's quality, OS risk mitigation, and regulatory confidence. Thank you for watching. If you found this explanation helpful, please like, share, and subscribe. In the next video, we will cover dissolution in QC versus R&D versus stability, what changes and why. And stay tuned because in this 62 video series, we will dive through dissolution method development, validation, troubleshooting, advanced approaches, and real industry case studies. If you have any question, please post them in comment section. See you in next video. Thanks.